Hey everyone, and welcome to today's Explainer. I am absolutely thrilled to be here with you because today we're diving into the body's ultimate biological rescue system. We're talking about sympathomimetics, specifically those heavy-hitting adrenergic agonists like epinephrine and norepinephrine. Real quick, make sure you've got those English subtitles turned on so you can follow along perfectly and read what I say and say what I write.
Now look, I totally get it. Pharmacology can be incredibly dense. It's like the great Charles Dickens wrote, it was the winter of despair. And let's be honest, nothing quite says winter of despair like staring down a massive pharmacology exam. So if you're feeling like a totally confused neuron right now, just overwhelmed by all these receptors and pathways, take a deep breath. We're going to clear that fog and completely conquer this together today.
All right, let's set the stage with a foundational concept. Your autonomic nervous system basically has two main gears. First, there's the parasympathetic system. That's your rest and digest mode. Sitting on the couch, catching a nap after a big meal. But then there's the sympathetic nervous system. Imagine you're suddenly running from a tiger. Your body literally doesn't have time to think. It needs an automatic, massive response to keep you alive. Your heart rate skyrockets, your lungs open wide to just gulp in oxygen, and blood rushes straight to your muscles. Today, we are focusing purely on the drugs that artificially trigger this tiger-evading, life-saving sympathetic response.
Okay, moving on to our biological hardware, alpha and beta receptors.
To truly understand how these drugs save us from that tiger, we have to look at the hardware they plug into. First up, alpha-1 receptors. I want you to permanently associate alpha-1 with the color red. Red means high alert, right? When a drug hits an alpha-1 receptor, it causes intense vasoconstriction. It completely clamps down on the blood vessels in your skin and mucous membranes, squeezing that blood out of the periphery and shunting it exactly to where you need it most. So remember, red means squeeze.
Next, we pop over to the betas, and we're going to highlight these in blue. Here's a super simple mnemonic that works every time. You have one heart. So beta-1 receptors primarily affect the heart. When they get stimulated, they act as a positive inotrope, meaning they crank up the actual force of the heart's contraction, and they're a positive chronotrope, meaning they increase the heart rate itself. One heart, beta-1, pumping incredibly fast and hard.
And right alongside it is beta-2. Let's keep that same mnemonic going. You have two lungs. So beta-2 receptors are the absolute heroes of your respiratory system. When you activate beta-2, it causes powerful bronchodilation. It relaxes all that smooth muscle in your airways so you can take massive, life-saving gulps of air while you're sprinting away from that tiger.
Now check out this table. I promise you, this little matrix will save you a massive textbook headache. It brilliantly summarizes how our drugs actually interact with those receptors. Look at epinephrine. It has a high affinity for both alpha and beta receptors. It's basically a master key. Norepinephrine, though, high affinity for alpha, but remarkably low for beta. And isoproterenol is the exact opposite. It's all beta, very little alpha. Keep this visual locked in your head.
Section 2. Meet the catecholamines.
Now that we know the locks, let's formally introduce the keys. These are the biological heroes of today's explainer: epinephrine, norepinephrine, and dopamine. Let's just speed through their pharmacokinetic properties really quick. Remember to say what you write as these pop up. First, high potency. They directly and intensely activate those alpha or beta receptors. Second, rapid inactivation. Your body breaks them down incredibly fast using the enzymes COMT and MAO. And third, they are completely ineffective if given orally. Why? Because the enzymes in your gut and liver will literally destroy the drug before it ever has a chance to reach your bloodstream. So they absolutely must be given via injection or IV.
Let's zero in on our first heavyweight, epinephrine, the ultimate rescuer.
Epinephrine is the true, undisputed champion of the fight-or-flight response. When a medical situation is absolutely critical, this is the drug you reach for. We need to map exactly what it does back to our tiger analogy. To run, your heart needs to pump, right? Boom, epinephrine hits beta-1 to increase cardiac output. You need your lungs wide open. It hits beta-2 for powerful bronchodilation. You need blood shunted away from your skin. It hits alpha receptors to constrict those vessels. And finally, you need raw energy to burn. It actually triggers your metabolism to initiate lipogenesis and spikes your blood sugar, causing hyperglycemia. Your body is instantly, perfectly primed for survival.
Because it does all of this simultaneously, it has incredibly powerful clinical uses. Anaphylactic shock, this is the absolute #1 drug of choice, no question. It reverses the closed airways and the plummeting blood pressure all at once. It's also used to restore rhythm in cardiac arrest. We even mix tiny amounts of it with local anesthesia. That intense vasoconstriction keeps the numbing medicine localized right at the injection site so it lasts way longer. It's even used in intraocular surgery to dilate the pupils. That's practically magic.
Moving right along to norepinephrine, intense vasoconstriction.
So, let's pivot from epinephrine to its close cousin, norepinephrine. Now, they sound super similar, but they behave quite differently because norepinephrine heavily favors alpha receptors over beta receptors. And remember our red highlight? That means it causes intense vasoconstriction. It aggressively clamps down on most vascular beds, including the kidneys. This massive squeeze violently raises your peripheral resistance. In fact, the blood pressure spikes so rapidly that your body literally panics and hits the brakes on the heart, a phenomenon we call reflex bradycardia.
Because its main trick is this overwhelming squeeze on the blood vessels, its clinical use is very specific. Norepinephrine is the absolute go-to for treating shock, specifically states like septic shock. When a patient's blood pressure dangerously bottoms out because all their vessels have inappropriately dilated, norepinephrine is the hero that jacks that vascular resistance right back up to keep the blood flowing to the brain and vital organs.
All right, bringing us to dopamine and, of course, side effects.
So we've survived the tiger, we've stabilized the blood pressure, now let's talk about our final catecholamine, dopamine. Dopamine is fascinating. It stimulates beta-1 on the heart to increase output and alpha-1 on the blood vessels to increase resistance. But here is the massive differentiator. It has a special relationship with the kidneys. Unlike norepinephrine, which clamps down and diminishes renal blood supply, dopamine actually enhances perfusion to the kidneys and splanchnic areas. This increased blood flow causes diuresis. It helps the patient produce urine, which is incredibly useful in a clinical setting.
Now, as we wrap up these powerful drugs, we absolutely have to talk about toxicities. And I've got a golden rule for you here, a tasteful little inside joke for any student facing a pharmacology exam. If a professor ever puts you on the spot and asks, what are the side effects of this specific medication, and your mind just goes totally blank, just confidently say nausea, vomiting, and diarrhea. We call it NVD. Honestly, in 99% of cases, you'll be correct because almost everything in medicine upsets the stomach.
But getting back to the specific reality of sympathomimetics, because these drugs mimic a massive, non-stop adrenaline rush, their actual adverse effects look exactly like extreme, prolonged stress. We're talking about severe anxiety, tension, hyperactivity, insomnia, and just pounding headaches. And more dangerously, because of that extreme vasoconstriction and cardiac stimulation, they can trigger life-threatening cardiac arrhythmias and pulmonary edema. You are essentially revving the body's engine way past the red line, so they require incredibly careful clinical monitoring.
And with that, let's close out with a high-energy confused neuron quiz. It's time to prove that your brain fog has been fully cured today. Which drug is the absolute hero, the indisputable drug of choice for anaphylactic shock? Think about it for a second. That's right, it's epinephrine, because it perfectly stimulates both the heart and the lungs while constricting those vessels. You are now officially empowered to conquer the complexities of adrenergic agonists. But I want to leave you with this to ponder. If we can artificially mimic the fight-or-flight response so perfectly to save a life, what happens when we start hijacking the rest and digest system just as powerfully? We'll tackle that exactly in our next explainer. Thank you so much for joining me today.